Live look now at the Capitol Hill, where today marks day 10 of the government shutdown, and layoffs have begun for more than 4,000 federal workers. Notices are being sent across several federal agencies, and for many, today's paychecks could be the last ones received until Congress agrees on a spending package for the current fiscal year. The federal government shutdown is now hitting local doctors and medical facilities in the pocketbook. Money has run out for telehealth visits for people on traditional Medicare. As Daryl Huff explains, that's affecting local providers and their patients who have a hard time getting to doctors' offices.
It's important to point out that the lapse of money for telehealth only affects people covered by traditional Medicare. That's about 150,000 seniors in Hawaii. And it is hitting hard in areas where doctors are already stretched thin, like on Molokai.
We're quite aware of the ups and downs, the yin and yang, pull me this way, pull me that way. And yes, it's all very stressful.
Betts Cruz and her husband John have health issues typical to people in their 70s. They also live on Molokai, where Hawaii's physician shortage is most severe.
It's been difficult and very important to have telemed. You're right, we can't survive without it.
And one more.
Their doctor is Hilo-based physician Kauimano Dang Akiona, who relies on video visits to extend her practice over 3 islands.
I can be sitting in Hapuna, one of my clinics, and someone can walk in Molokai and we can provide them pretty good care.
Even having any drips.
Many of her patients are on traditional Medicare, where telehealth money is now clogged in Congress. Like most doctors, they are still doing the visits despite the risk of not being paid.
The care needs to continue, but with the hope that the coverage is going to be reinstated at some point, and that this would be retroactively covered, but there's no guarantee.
Queens Health Systems has embraced telemedicine with over 200,000 video visits a year. Dr. Matthew Koenig says about 10% of those would be affected by the funding lapse.
I want people to understand that there is a financial risk that Queens is taking in doing this, because what Queens is doing is saying, we are going to continue to offer telehealth services to our seniors because we know they need that care.
Chesty cough or a dry cough?
Queens can handle it, but the strain will be real for smaller, independent practices.
And that's particularly true of providers who are geriatricians, who see a lot of Medicare patients over the age of 65.
Dr. Akiona is also absorbing the cost of about 30 video visits a week and scrambling.
And so what we did was we actually called everybody and had them reschedule to the days that I had a physician in the office.
It's very stressful. It just adds that one more level of stress.
Like everything else tied to Congress, no one is sure how long this will go on. Last year, Senator Brian Schatz introduced a bill that would guarantee funding for telehealth. It had a majority of the Senate as co-sponsors, but still hasn't passed. Daryl Huff, Hawaii News Now.